Hey everyone, this is Hannah with the Rocket Miner giving you today's video update. Today I wanted to go over some more facts about COVID and how things are going in Wyoming, where our numbers are at, what the cases are looking like, and just some more thoughts and ideas about that. So to give you the numbers, today for Wyoming we're up to 1,428 confirmed cases, 346 probable cases, and 1,313 recoveries. So this means that we're up by 24 new confirmed cases since yesterday, 10 new probable cases, and 22 recoveries since yesterday. So when you look at all the numbers together, that means we have 461 active cases in Wyoming right now, and that is up by 12 since yesterday for looking specifically at the active cases. So what we're seeing, I know there are so many numbers, and I try to give you numbers that are helpful, that kind of put things in perspective on where we're actually at. So what we're seeing is that we are still seeing most people recover. We are still seeing more new cases than recoveries at this point, so that is still growing. And then the active cases do keep going up to a degree that's still concerning. Also, we've seen that some of the hospitalization numbers are going up right now. According to a story that we got through the Wyoming News Exchange from the Casper Star-Tribune, they said the number of coronavirus-related hospitalizations in Wyoming has steadily risen in recent days. They said there are now 13 Wyomingites hospitalized from the virus. While this is still a relatively small number, it's the highest such number in Wyoming since May 26th. They said there were 6 hospitalizations on July 4th, and there were only 4 in early June, so now we're up to 13. Thankfully, they also reported that the severity of the hospitalizations appears to be relatively low. According to state data, only 1 ventilator is currently in use statewide, and 45 intensive care beds are being used, though that number is for all conditions, not just the coronavirus, and that's out of a total of 120 beds that are available in Wyoming. Dr. Alexia Harris, the state's health officer, said during the press conference yesterday that the state still expects to see more hospitalizations and deaths. So this number is going up a little bit as far as people who have to be hospitalized because of COVID, but thankfully things aren't too severe at this point, and we still have a lot of resources and hospital availability. So Wyoming is still doing pretty good in regards to that, especially compared to some other states. But there is still a concern there, and a concern that if the cases keep rising, that we will continue to see more hospitalizations and deaths. And you also have to keep in mind with that sometimes there's a lag. We see these new cases, but it's like, oh, not that many people are hospitalized though, so it's fine. But lots of times those new cases, it takes a while for them to develop into the place where they would need to be hospitalized. So when we see a spike in new cases, it's probably going to be a little bit before we see a spike in the hospitalizations or deaths related to those cases. So that's just something to keep in mind, and something that we want to keep our eye on and keep being careful about. Thankfully, we are seeing lots of recoveries still in Wyoming. We are seeing a lot of these cases that do recover. And we heard a story recently about one of those recoveries specifically. The Jackson Hole News and Guide shared a story about Anthony Parker, a Jackson Hole man who spent 88 days in the hospital because of COVID-19. He is 61 years old and spent this time in the hospital with a lot of really serious health symptoms and complications because of COVID. They said that during the 3 months he was in the hospital, he was transferred to Eastern Idaho Regional Medical Center and then back to St. John's, the hospital he started at. He spent a month and a half in a coma, and he battled for his life alone in Idaho Falls, far from his family. The story said the ordeal has left him weakened, struggling with a bevy of problems COVID-19 unleashed on his body. But Parker is finally home and determined to face the long recovery head-on. The story gives a lot of details about his time in the hospital and his relationship with his family and how they felt during this time. It's a really good story. Definitely encourage you to go read it. One of the things that stood out to me reading the story that I thought was really interesting and really sobering was just the effect that they said COVID-19 had on Parker. This is from the story. They said, in his pre-COVID days, Parker was a motorcycle rider. Tattoos wrap around his arms. His daughters say he projected strength. He was a person who might ignore an injury until it went away. He was a family man who moved to Jackson in search of better work to provide for his wife. Now he's in a wheelchair, trundling along with an oxygen bottle, the nasal cannula hooked into his nostrils. He speaks slowly, catching his breath between thoughts. His hands shake like he has Parkinson's, and he can't open a pop bottle. So the story was exciting, and it was great to hear that he's recovered and he's home after such a long battle, but it was really sobering to me to realize just the effects it had on him. And I have heard other stories from people who had COVID-19 who are listed as recovered, but are still facing so many health problems that they never went through before. And I think that's one of the things that people don't necessarily realize about COVID at this point, and something that we're still seeing and still learning about, is the continuing health effects that it can have on people after they have technically recovered. And some people are wondering if these health effects are things that are going to last through people's entire lives, that have changed the course of their life. Things like breathing problems and shaking, or just loss of strength or energy, or problems with blood clots. I've heard lots of different things. And I think it's just something that we need to keep in mind, and something that we need to be aware of, is that we are still learning a lot about the effects that COVID can have on people, and healthy, strong people, not just people who had previous health problems that put them more at risk. So there's a lot still to learn, and I want to make it clear today that I am not trying to fearmonger. That term gets thrown around a lot, especially relating to the media. They say the media is just sharing these big numbers, and they're sharing these gloomy stories because they just want to make people afraid and they want to control people. And I hope that most of the people here realize that that is not what we are doing, that we are a small local newspaper, and I've said this before, that we're your friends and neighbors, and we're going through things too, and we're doing our best to learn and to share helpful information. And I know it can be scary, and it can be hard to look at the numbers and look at the more negative stories and effects that we're seeing, and that can be really scary. It's hard to report those things, but it's never coming from the rocket miner, and I think I can speak for our team here on that aspect and say that we're not trying to fearmonger. We're not trying to sensationalize things. That's not our goal or our purpose here. We genuinely care about sharing helpful information and sharing accurate information. And I want to encourage everyone to please fact check things and do research. It's so important, especially right now and just in the world we live in. There's so much information that goes out there and so many things that get shared. And there's just a lot of people talking, and you kind of have to sort through things to figure out what's true, what's accurate, what has information to back it up. But I want to say that we do try our best as a newspaper to fact check, to research, to not share things that we think are inaccurate. And again, with just so many voices and so many sides on issues like this, I know that people don't always agree on what is accurate information, but I want to say that we do try to share things that are accurate and helpful. And sometimes those things are negative, but I think it's important to not gloss over the experiences that people have and the things that they go through. We want to share those, and we want to look at all sides of the issue to figure out what's accurate and what's true and what's helpful. I want to encourage people also to please read stories before you assume what they're about. I know with newspapers you have a big old headline that's supposed to sum up the entire story. I just gotta say, it is really hard to write headlines, especially with complicated stories. It's hard to find a couple of words to sum up what that story is about. So sometimes the headline does sound a little more sensationalized, or it doesn't fully capture all of the nuances of the story. So before you just read the headline and assume you know exactly what it's saying, please look at the story and read through it and see what the story says, what information it has. And also realize that we share a lot of stories from a lot of sources. Lots of them do come from us, lots of them come from other Wyoming newspapers. And then we also share Associated Press stories that could be about national news as well. So please take a minute before you assume what the story is to check it, to see its source and where it comes from, and to see what it actually says before you start arguing about what you think it says. I think that helps clear up a lot of misinformation and miscommunications that happen. And yeah, just really want to encourage people today just about the importance of fact-checking things. Don't just share things because they sound good or because they agree with a point that you're trying to make. I know it's easy and tempting to do that, especially with Facebook, where so many things come through, and all social media, where we see things, we're like, yeah, that makes a great point, I'm going to share that. But did you actually look into it to see where that information came from, whether or not it's reliable? I think that's just a really important thing, especially with serious issues like this. And one other thought I wanted to share that I thought was interesting. Today I was listening to a podcast that I listened to, and one of the guys talking, he made a really interesting point where he said, our country has kind of this history of a distrust of authority, and that is a good thing and can be a very healthy thing to fact check our authorities and to keep them accountable. But he said, this distrust of authority has become more and more equated with a distrust of expertise. And that's a problem, and that's dangerous. When we start to see scientists and doctors and people who have spent their whole lives studying things just as authorities to distrust, that can actually cause problems, because we need to listen to experts who know more about these issues than we do. And yes, please listen to multiple experts and fact check them against each other and check multiple sources. That's really important too. But just to say, oh, they're an authority, I think they have an agenda, I think I can't trust what they're telling me, I think that can be really dangerous and can lead to a lot of problems. So those are just some of the thoughts that I've been having today, and I think that this relates very directly to COVID, but it applies to things all the time, not just this, that we need to check our information, make sure that it's reliable, and do some research. It takes a little more time and effort, but it's important for us to know why we believe what we believe and know that we can back up the statements and opinions that we have. So I just want to encourage everyone to do that today. So thank you for listening. We'll keep bringing you more news and updates, so keep checking back with us. Have a good day.